Hi Milo, how are you?
Good, how are you?
Good, I'm Dr. Sajan, nice to meet you.
Nice to meet you too.
And I heard you're Lily, Milo's partner.
Yeah.
Awesome, well thank you both for being here. I'm so excited to see you. I know we're here today because we're thinking about top surgery, is that correct?
Correct.
And I heard Lily found me off TikTok, is that correct?
I did find you on TikTok. It's a little bit strange just to be like, oh yes, this thing that could change my life. I found it on TikTok.
Yeah. It's definitely almost a very funny story to like tell people like, oh, how did you find this? Oh yeah, I just found it like on TikTok, just, you know, around. And it's like, oh yeah.
So, you know, sometimes it takes a moment to change a future in a life,
Yeah.
you know. So I appreciate you both being here and, you know, being part of our pro bono program. The goal with the program is to help people who aren't able to afford surgery, don't have the benefits of surgery, so we can help them get this medical necessity. That's the way we see it. Right now, you know, the program is being funded by Just the Practice, and we do it because we believe in what we do, we believe in the community, we believe in the cause. And one of the most important things for me, and the reason I do this, is we love impacting people in our community in a positive way. And I feel there's no more positive way than letting somebody be themselves, be happy in their own situation, and live the life that they feel they were meant to. You know, I do so many different surgeries. Out of all the surgeries I do, there is nothing more transformative that I see than gender affirming surgery. Every surgery I do, when I see my patients, you'll hear me say, if you watch some of my videos, I'm so excited to do the surgery, and I really am. Everyone is new, everyone is exciting, and every patient is a story. And I always remind myself that it's my privilege to do, so thank you.
Thank you.
So what we'll do next is Mackenzie will get her room ready. She'll be right back and we'll take it from here.
All right. Thank you very much.
Thank you, Milo and Lily. Really nice meeting you, and I appreciate you coming to me.
Yeah, thank you so much.
Thank you.
It's been like my dream for many years to get this procedure done. I've wanted it since I was like 14, I think. And it's just one of those things where I've always like wanted to be like other guys, where I could like, you know, go to the beach and just take off my shirt, just kind of be completely flat-chested and just be able to live like I want to. I'm 19.
How did you hear about the pro bono special?
So I actually heard about it through my wife. She was on TikTok and following Dr. Sajan when he released the announcement of this, and she's a med student, so she was following him for all the like surgery stuff, and then was like, oh, this is perfect, and just you know, we immediately applied for it. Like, I think you found it within like 20 minutes of it posting?
Yeah, I found the announcement within 20 minutes of it going up, and I immediately started drafting and writing everything that I could think of. And you know, once I had done that, I sent it to you and I was like, we need to do this. I found it as soon as it went up, but I couldn't sleep that night. I didn't sleep at all because I was so excited, because for the last, I mean, at that point, for the last full year, we had been just trying to save up for this surgery, and we hadn't gotten anywhere close to what we needed, just because, you know, cost of living is so high here, and I am going to school and everything is, you know, everything costs so much money. So we had not enough, and then I found this and I was like, oh, this could save us years of time and suffering and, you know, minimum wage jobs. So we were just overjoyed, very excited.
And it'll save a few more years for my ribs too, because wearing binders sucks. So
I can't imagine.
His generosity and just like, I guess I'm just like so amazed that this surgery could be pro bono at all. Like, I feel so lucky to be able to be in this position at all. And Sajan is the only one I know of who would do anything like this. So at this moment, you know, fingers crossed.
Yeah, and I'm not a med student yet, but I'm a pre-med student. I'm going to the UW. It's the kind of thing I've been following a bunch of surgeons just to try to see, you know, what the field's actually like. Why Dr. Sajan is because, again, this opportunity is completely unique, but also, you know, he's been widely touted as one of the best top surgeons in the nation. And so it's the combination of, you know, kind of generosity, altruism, and then just skill. You know, I've seen Seattle described as like a mecca for people trying to find top surgery. Everybody around the country comes here to get it done. And of the lot that we have in Seattle, Dr. Sajan is the best. So, you know, that kind of thing. Even if we could afford this, we would have done some Sajan. So.
Hi, Milo.
Howdy.
Hi, buddy. We'll take a look, okay?
All right.
Thank you. And we'll do some measurements and take a look.
Okay.
So, if you don't mind, I'll have you stand over here and I'll use a marker and a ruler. Is that okay, Milo?
Yeah.
Alright,
That's totally fine.
Okay, we'll take this. Mackenzie, here you go, buddy. Okay, thank you. And it's okay if I make a few marks?
Yeah, that's fine.
All right, thanks, bud.
Mm-hmm.
Can you relax your hands from me out of your pocket?
Oh, yeah.
Perfect. Nice and straight shoulders. Good. Well, the good news is the decision is really simple based on your anatomy.
Okay.
And I'll show you in the mirror, but the only option that will work for you is a double incision, in my opinion.
Okay.
Okay?
Totally fine.
I'm going to show you the scar shape that I'm going to go with. Make sure you like that.
Okay.
I'm going to give Mackenzie some notes.
Okay.
Mackenzie, it's going to be a double incision chest reconstruction, free nipple graft, liposuction, right chest, left chest. Here you go, Mackenzie. Okay, patient prefers an incision that follows the pec. The left breast is bigger than the right. The right nipple is higher. The right fold is higher. Let's go look in the mirror, my friend.
Okay.
The reason I feel you are not a keyhole candidate is there's too much tissue on this side and the areola is large.
Okay.
See, so a keyhole would involve only making this incision, right?
Yeah.
I would go in through that incision, remove the tissue, and then count on the skin and everything shrinking around it. Based on my experience, I feel there's too high of a risk of lumps, bumps, divots, and irregularities.
Okay.
So I would recommend, based on my experience, is we make a double incision. Make an incision from here to here. It'll go straight and then curve and follow the muscle.
Okay.
I'll remove the tissue with the nipple, resize, reshape this, make this the size of a nickel, move it up here.
Okay.
Okay? And then we'll sculpt it and make it nice and flat to fit your body. A liposuction here and a liposuction there to give you a nice contour.
Okay.
How does that sound?
Sounds good. I was also debating on maybe just not having nipples whatsoever.
Sure.
Do you have any like?
It's your decision. You can go either way. Whatever you feel
Okay.
identifies most with what you are.
Gotcha.
I've never had any of my patients ask me to remove a nipple, and they've all been pretty happy with it. But all the no-nipple people love the no-nipples.
Yeah.
It's difficult to pass on a beach or some kind of setting without a nipple.
Yeah. I think I'm gonna go no nipple.
Okay.
But yeah.
Sounds good. Awesome. Have a seat over here, my friend. So what inclines you to go no nipple?
I don't know. I guess because I am transmasc, but I'm not like 100% like binary man.
Yeah.
Like, I am non-binary. And although I do want to pass as like, I want people like strangers to look at me and think, oh yeah, that's a man. I'm not completely gender conforming. So it's also one of my friends has had top surgery, and they've gone no nipples, and I just like to look.
That's awesome. I've heard that many times, and I'm happy to do that for you. Can you share with me, what does non-binary mean to you?
To me, I guess that's a complicated question. It's very much like think of what a man is in my mind. I'm not completely that, but I'm very close, and I'm definitely not a woman. Like I've debated that a lot, obviously, and I'm like, that's not where I'm at. And so it's, for me, my gender's something around there, but not quite that. So I guess non-binary is just, to me, it's just neither, but for some people it could be both or something. Sometimes I think, I'm like, oh, maybe I feel like a third thing that just I don't see, really. And yeah, I kind of just bounce back and forth between almost completely male and like some third thing.
Okay. I understand. And how does not having nipples help you feel more non-binary, if you will?
I think some of it's just going to be kind of like I like the sensation of just the completely flat, like totally smoothed over.
Yeah.
That makes me excited. I'm like, oh, I could totally be that.
Yeah.
But I guess in a weird way, because I know that I guess some people will unfortunately never see me as a man, or like even trans mask or whatever. And just being like, hey, well, I'm being happy being myself, even if that's not what you picture. So like even just like going completely like no nipple, just I'm happy doing my own thing, you know. Makes me happy, I guess.
That's awesome.
It's just sort of like F you to them, you know.
I understand. What happens next is your case will be sent to our medical review committee.
Okay.
And then they'll discuss it, and if they feel that you're a good candidate and you're safe and low risk, then we'll go ahead and move forward from here.
All right.
Okay.
Awesome.
Cool. Well, it's so nice meeting you, Milo.
It was amazing to meet you.
Yeah, Lily, such a pleasure. Is there anything else I can go over?
Can you give us an estimate on when this would be happening if it does go through?
We'll let you know as soon as we can. No later than within 3 weeks, and then obviously we'll give you options to schedule it per your availability. Sound good? Wonderful. So we'll follow up with you within 3 weeks, and we'll take it from there.
Wonderful.
Okay. Thank you.
Awesome.
Yeah. Nice meeting you.